Well, typically infectious diseases is you go through an internal medicine residency program and then do 2 or 3 years after that for a fellowship to specialize in infections, tropical and parasitic diseases, and pretty much anybody that has a fever. But one of the areas that's really fun to take care of is travel medicine and trying to get people ready for trips anywhere. And, if you did happen to pick up something, then chances are that we've seen it and we know how to take care of it. There are about a dozen infectious disease docs in the state here. Some places like you go to Seattle and they'll have a dozen in their one division. But we're kind of spread thin. I think I'm the one for about a 100-mile radius. So we're going to talk about, I split this up into kind of 2 talks. One is just getting ready for international travel, and then the other is about Zika. And with a small group like this, we can have it a lot more interactive. Let's see what happens. So everybody's got a different idea of what kind of travel to do, and it really makes a difference because that's going to determine what sort of immunizations you need, what sort of precautions you need to take. So whether it's a business trip, if you're just going to be going to someplace where you're in the city in a hotel, your risk is a lot less than if you take a vacation, or if you're on a missionary trip, if you're gone for 2 years, or teaching jobs. I've had some folks go on teaching jobs, and that can be pretty intensive in terms of how to protect somebody from picking up these different illnesses. Sedona, not too far away, but not too bad. I hear they have some magical healing properties. I don't know. Vortexes, yeah. May want to go to Tibet and just enjoy that. I rather like just showing these pictures rather than just talking all the time. Maybe go to Tibet. Just some nice places to travel, and I've got a lot of people that go on trips and they bring me pictures. I stay here and they all go travel. Go figure. So what helps me figure out what you're going to need is what your itinerary is, how long you're going to be there, and what sort of things you're going to be doing. It's helpful to know what kind of medications you're on a regular basis, and then how you're going to transport them and keep from losing your medications, or are there some that you can actually leave behind and not take with you? There are certain travel medications that we go over with you to keep you safe. What kind of clothing you're going to bring, it's important, especially if you're going into a malarious area. Insect repellents, what kind, first aid kit, what would you like to bring for that, and how to have safe food and water. I like this. They have an ice climbing festival every year down in Highlight. Just something fun to do. Scary as all get out, I guess. Well, what sort of things are you going to be exposed to when you go travel? The big one is diarrhea. Why does it do that? Here we go. Diarrhea. And that happens maybe 5 to 10% of the time when you travel. The longer you go someplace, the more you're at risk. But that's like the number one thing that people get into trouble with. And it's really bad. You're going on a short vacation you saved up for years, and then this hits and you're stuck. So we can do some things to help out with that. Tetanus and diphtheria. Tetanus is always important. Wherever you go, you could get cuts and scratches. So it's good to be up on your tetanus shot. Polio isn't so much of a problem anymore. It's almost eliminated around the world. There's only a few countries left where you really have to worry about it. And India's been polio-free now for about 3 years. Malaria is a risk depending on if you're going to tropical or subtropical areas. Yellow fever has made a comeback. I mean, all our yellow fever vaccine is going over to Africa to take care of this outbreak. So trying to find yellow fever vaccine here now is really a difficult problem. There's all kinds of hepatitis that you could run into, A, B, C, D, and E, and there's an F and a G you don't really worry about for travel. HIV is a risk when you travel any place you go. Depending on where you go, they may have a much higher concentration of people who live there with HIV, and they may not be on medications like they are here. Around here, when you're on medication, your viral load is very low. there's much less risk of transmitting it, but depending on where you go, you may have a much higher risk of getting exposed. You like to sample the local food. Depending on where you go, you might find some nice fresh vegetables, but look at all this here that's on the ground, and you know, what's in that water that's in there. Or you may not want to sample the local food. I'm not sure I would really want to try some of this. Or this kind of farming for rice paddies, and you know there's going to be a lot of excrement that ends up in the soil there and in the water, and that's eventually going to get into whatever they're growing. And that is a problem for here, hepatitis A. I've mentioned about the tetanus booster, Tdap, for tetanus, diphtheria, and adult or acellular pertussis. So the new vaccine here, the Tdap, has pertussis in it, and that's good for 10 years. And we've had an upswing in pertussis around here. We've seen that in the high school and middle school in the past couple of years. The new vaccine that we have, not as good as the old vaccine that we used to get as kids that could cause things like febrile seizures, and it was really painful for kids to get. The new one isn't as painful, but it's just not quite as good, and they're working on a new vaccine. But you do need to get caught up on your tetanus boosters, make sure that you're protected from diphtheria, pertussis. Hepatitis A, I think this is the second most important immunization that you'd want to get. I think anybody that eats at a restaurant ought to have Hep A vaccine. Most U.S. adults are not immune. The immunization, it's actually 2 shots. You get one before you go and one 6 to 12 months later, and that's it for life. Night soil is human excrement that they use as fertilizer, and they do that a lot in third world countries and places outside the U.S. When you're traveling, you could run into hepatitis A with the water that comes out of the shower heads, or if you're brushing your teeth with tap water rather than purified water, or the ice cubes locally. So a restaurant may be really good and have good food, but if they make the ice cubes with the local water, that could be a problem. So this is an area where you might expect that you could worry about night soil and hepatitis A as a risk. Other things that you could get beforehand, the polio vaccine. CDC still recommends a one-time polio booster if you're going to one of those areas that still has polio. Hepatitis B series, most people get hepatitis B series now as a kid, as an infant, and those are good for life. And the only reason not to get that is cost and for time constraints. It usually takes 6 months to get the whole series of 3 shots in. And so a lot of people don't think about travel that far ahead and get them done. Depending on where you go, there's meningitis. Equatorial Africa has what's called a meningitis belt. So if you're going there, you might think of getting protected against meningitis with the vaccine. And there's even a new vaccine that's come out for type B, which is the one that's been circulating around in colleges. And typhoid is one of those that we like because it's a series of capsules. So you don't have to get a shot, you just get these capsules and swallow them, and it gives you 5 years of protection, and it's a lot less painful. It used to be that shot was one of those that we'd have people come in on a Friday afternoon, get their typhoid, and say, just go home, you're gonna feel miserable all weekend. New York might be a nice place to go. But then again, there's a lot of other people that want to go visit it too. And what we see is like, they did it again to me. Measles outbreak. Other travelers coming in from overseas that may not have had the measles vaccine, you may be exposed to them. This is what happened in Disneyland this past year. We had some unimmunized folks that were visiting Disneyland and were able to spread measles, and it was able to be spread through other folks, and we ended up with cases, I guess, as close as Spokane. That's kind of settled down. German measles, not so much a problem. Cholera, we don't really see around here, which is a good thing because we don't have a vaccine for it anymore. Rabies and plague, not something you're going to see very often, but depending on where you go, there may even be outbreaks of plague.
What about TB?
What about TB? Everybody's interested in that, aren't they? Depending on where you go, there's a higher incidence of TB. I think last year in the state we had 5 cases of active TB, but if you go to Southeast Asia, if you go to India, certain places in Africa, there are a lot higher concentration of it. India is one of those areas where you would see a lot of partially treated TB, so it has gotten resistant, and some of them are easier to spread from person to person. I don't have a way to protect you from getting it in the first place, but that's one of those things that we test for when you get back from overseas, especially if you've been in an area where you might have been exposed.
I just noticed you included here, so you don't think of it as that much of a problem.
It's depending on where you go, the risk, it can be low to moderate. It's not really a high risk unless you're going to be going like on a medical mission, for example. If you're going to an area where you're working with a lot of HIV and TB go together, or there are TB clinics around the world that you could go to work, but otherwise as a tourist your risk is fairly low. But that's something that's always on my mind, but I don't have a vaccine that I can use to protect people. And that's one of those things that you look at when you come in, is that a lot of people go to the CDC website for travel, and it's very complex. So what I like to do is to look at your itinerary and find out where you're going, how long you're going to be going, and do sort of a risk assessment of what you're going to need, which immunizations you really need, which do you not need so much, which kind of medications should you have along in case you get into trouble. So what you do is you look at the country data and look at diseases. There's also sometimes you need to have visas. In the clinic we have official forms that you might need for keeping track of your immunizations. The World Health Organization has a yellow card that you keep track of your immunizations, and you can put it in the back of your passport. Yellow fever vaccine, as I said, it's really hard to get. There are only 3 or 4 places in the state where you can get yellow fever vaccine. It's through City County Health. In Bozeman, we don't have any of the vaccine anymore. For malaria, if you're going to an area that has malaria, you want to take malaria pills along with you. And that's changed over the years. A long time ago, chloroquine was sufficient. You'd take it once a week and you'd be protected, and it was pretty cheap and it had low side effects. But then they came out with Lariam that you would take once a week for the resistant malarias, and it could do anything from causing weird dreams to making people psychotic. So I don't like to use that one anymore. And now we have the Cadillac of malaria medicines called Malarone. You have to take it every day, but really low on side effects, and it works just about 100% of the time. And if you're going to some place where they do have malaria, during the day you're perfectly safe. The kind of mosquitoes that carry this are only out at dusk into nighttime. So during the day you're fine. At nighttime, as the sun's going down, you're going to be at risk, and you're either going to do mosquito avoidance from one way or another, or medications. And the side effects that could be a major problem, really not so much anymore with Malarone. India has a lot of problems. They even had a plague outbreak a few years ago. And at one time we did have a plague vaccine, but I don't have that anymore. We see plague around here sometimes too. Heard of that? In prairie dogs in Wyoming and South Dakota. So the one thing I'll just mention here is that many physicians are not aware of travel medicine problems, how to keep you protected, what you need, what you don't need, what can go together, what can't go together. and what sort of medications are good to take along. The CDC website is a lot of times where people start, but it's trying to be all things to all people. It doesn't focus on your particular type of trip, whether you're just going to be in the cities, whether you're going to be out camping, whether you're going to be in the jungle. So I try to help you out with that. But a lot of people start there and get an idea of where they're going to be, what they want to see, and then I try to help out with that. I don't know if that's local or not. Other things we deal with are mountain climbing with altitude illness and high altitude pulmonary edema, cerebral edema, and there are different medications you can take for that, and risk assessment for cardiovascular disease in case you're going to be at elevation. So the kind of things that we usually talk about for your usual trip, somebody going to Mexico for an extended stay, somebody going to Europe, you want to have an antibiotic on hand in case you get diarrhea. Those aren't things that you get over the counter, and it really varies depending on where in the world you're going to be. A lot of times Cipro still works, or if people can't take Cipro, we have other medicines that you keep on hand. And then if you get diarrhea when you travel, you take the antibiotic, and it lessens the length of time that you're sick. It may not completely eliminate it, but less days, and it will let you get through the vacation. Anti-motility agents are another thing to take. If you have diarrhea and you have to travel somewhere, I usually take 3 different things. One is Pepto-Bismol tablets. They're easy to take, you can travel with. They work pretty well for mild to moderate diarrhea and abdominal cramping. And they're just pretty handy. The next one, if things are a little more severe, Imodium AD, which is over the counter. And that works pretty well for most things. But then if you really have to get someplace, if you really have to travel and be on a plane or a bus or something, then there's a prescription drug called Lomotil, which they're little tiny pills. You take one, it shuts your peristalsis down so nothing moves for 3 or 4 hours. And you can get where you're going. Sunscreen's always a good thing to have if you're going to a sunny part of the world. Some of the medications that you might be taking increase your photosensitivity, you increase your risk of getting a sunburn. So you may have to have that just for travel. Insect repellents are always good to have, and I'll mention that with the Zika part. And keep your medications in their original bottles. One of the things that happens when you travel is if you put things in a pill container and they're not labeled, when you get to customs, if they don't know what they are, they may take them. Kind of the worst place in the world to go is Singapore. I mean, you can bring in Flintstone vitamins in a sealed container, and it's like, nah, we're not letting you take these in. I haven't had any problem with people with prescription bottles with prescription labels on them. So but then you run into the trouble like, well, should I put them all in one spot, or should I split them up in case I lose them in the luggage? Those are things to think about too. A lot of times what I like to do is to have 2 original bottles and split it up so that you don't, if you lose some, you still have some. First aid kit's not a bad idea. What I usually do is I run over to Walmart and see what they have, or Costco, and then just get kind of a basic kit. And then what I do a lot of times is just gut it and just take the kind of things that you need. A lot of these things are not really going to help you on your trip, and just try to pick the kind of things that you really need to take with you, like ibuprofen or aspirin. But it's a good thing to have just a travel kit that you can keep with you. Purell hand sanitizer is a good thing to take. A lot of times if you're washing your hands with local water, it may not be as clean as you like. Purell works pretty well. There's a way to keep your papers organized. You might want to make a copy of your passport, or copies of all your other papers, and keep them in a suitcase. Take bottled water, have safe foods. I mentioned ice cubes. You like to have salads and try out the food in the local places, but The salad can be washed with the local water, and there's always some risk involved whenever you travel and eat things. So 30 to 60 days before you go, try to come up with a plan of getting your immunizations. Anybody like this slide? Go back to that one. Look here, 1993. I just happened to find a little image that I wanted to put on there. It's lasted. It was easier than making a new one. Okay, so the other things that I brought along was for, I found this little kit over at Walmart too, and it has a little place where you can put ice if you need to keep things cool, like if you had to transport insulin or something that you just need to keep cool. As far as insect repellents, DEET works really well, but you don't really need to have 100% DEET. It works great, but it'll take your hide off. What I really like these days is, I use this for camping a lot, but when you travel, getting a SteriPen is really handy. So it's replaced my filter, and it's a lot easier to carry. And the newer ones are a lot more durable than they used to be. With a SteriPen, you can put this in any water source, and in 40 seconds you can sterilize it. It's got a UV light that kills anything in it. And all you have to do is replace the battery if it ever goes. And I've taken this, used it for about a year on the same battery. They're really handy.
Have you taken that abroad?
This one I haven't, but that's a new one that I got over at REI. I had an older one that worked pretty well. But I always carry a backup, either iodine tablets or chlorine tablets, just in case the battery goes dead, or, the bulb is rated for like 30,000 charges, but if your UV light quits working, then this quits working. I haven't had one go out yet. I've been pretty lucky. So Zika, Gallatin City County, and here we got a couple of local Zikas. So where'd they come from? So far, all our local Zikas, the ones we've had in the state and the ones we've had in the county, have been people that have been out traveling to areas where it's prevalent, like South America, and they've come back and had been infected already, and then just show signs and symptoms when they get here. So it's a different type of mosquito that transmits it than your malaria mosquitoes. So if you go down to where it's prevalent, like Miami, then you have to worry about the different types of mosquitoes that are there that are out during the day that could infect you. But the way this works is that most people that get it don't get sick. It's like about 80% of people that get bit by the mosquito, get the Zika virus, they feel fine. If not, they may have a mild illness, but you know what it can do in pregnancy. So you can get it from mosquito bites. A pregnant woman can pass it on to her fetus. It can be sexually transmitted. And
I'm assuming it can be sexually transmitted as well from a subacute case?
yes, that's in here too. But if you're going to get sick from it, it's going to be like a bad cold with red eyes. So you'll have fever, rash, joint aches and pains, but then you get the conjunctivitis, so the red eyes that go with it. Or you might have muscle pain and headache to go along with it. So if you get it, you could get this flu-like illness that lasts for about a week or so. You might have no symptoms at all, and a few people are going to get it, so it's fairly severe, where it would put you in the hospital and you'd need to have IV fluids, and pain medicine, antipyretics to help out. With pregnancy, it can do bad things. It can cause microcephaly, or the small skulls and brains that can happen. And that was found fairly recently, within the past year, when they looked at all the cases of Zika in Brazil. So they had a number of cases of microcephaly, and they were able to tie that to the viral infection. So we can see that. So far, we haven't had any problems here with the microcephaly and the cases that have come back and people have gotten pregnant. But it's one of those risks that we always worry about. So it can do all kinds of other things in terms of birth defects if you pick it up when you're pregnant. So far, no reports of any infants getting it through breastfeeding, though. It can also cause Guillain-Barré syndrome, where it's a progressive loss of muscle strength. Some people end up on the ventilator with the Guillain-Barré, but then it usually eventually wears off. Sometimes you get paralysis, if you get paralysis, and eventually you get better, but it does take a long time, and it's probably going to be an ICU stay for a prolonged period of time. So how do we find out if you have Zika? We have a blood or urine test to confirm an infection. What we're doing now in this area is doing both the blood and the urine. There's no specific medicine to take for it. There's no antiviral to get rid of it. And so far there's no vaccine, although there's kind of one on the horizon. So what do you do if you get it and you're sick with it? Rest, lots of fluids. They say don't take aspirin or nonsteroidals because of the risk of Reye syndrome. Use Tylenol to reduce fever and pain and let it run its course. After Zika, then you kind of have to worry that you're not going to spread it from person to person. Down in Florida, they have the right kind of mosquito that can transmit it. So people who were infected with Zika spread it to the mosquitoes would fly off and infect other people. And that's what we're seeing in other parts of the country too. But fortunately, those type of mosquitoes are such that they need a warmer environment and I guess a more humid environment, and they haven't been able to spread up this far into the northwestern U.S. I think we're pretty safe from not having the mosquitoes show up here. So how do you keep yourself safe when you're traveling? One of those things is to avoid mosquitoes. Be inside buildings. If you have a bed net, those can be helpful. Wear long sleeve shirts, long pants. Might be hard to do because where you're going, where Zika is prevalent, is in those areas where it's hot. But cover up. And there are different clothing that you can get. You can either spray your clothing beforehand, or you can get some commercial clothing that helps kill mosquitoes and other bugs. If you're familiar with this buzz-off clothing, Ex Officio makes this, and it's got these permethrins that are impregnated into the fabric. So when you wear the clothes, the insects will fly around, but when they land on the clothing, they die. It's pretty handy. It's good for at least a dozen washes, they say. I mean, I try to test out some of this stuff to see if it works pretty well. The other thing you can do is like REI and Walmart and Bob Ward, places like that, there's a spray called Permanone, and you can lay out all your clothing ahead of time, spray it down with this stuff, let it dry, and then pack your clothes and take it with you, and that's good for at least a week. We're insect repellent, so you have stuff for the clothing to protect you, and then you put things on your skin to protect you. Something that has DEET in it works really well, but if you get too much DEET, it can cause rashes and really cause your skin to bubble. So usually about 28-30% DEET is all you're going to need. It works just as well as 100% stuff.
Curious about REI carries a product it has for years called Jungle Juice, which is quite effective against mosquitoes, but I've kind of wondered how safe it is. It was apparently developed for soldiers in Vietnam, and they've continued to sell. Have you ever used it or had experience with it?
I haven't used that, but I had some of the military stuff. I used to have spray cans of that stuff around the house.
And is it really damaging to you, or is it, I mean, it's not a carcinogen.
I think it's kind of rough on your skin, and the stuff that we had from the military is really bad smelling stuff, but it worked. I haven't looked at the stuff from REI yet. I need to
Okay.
check that out.
Yeah, it works, but.
That's the thing is, if it works, that's what you want to use. And protect your family, same kind of things. You know, have clothing that protects your kids and keeps the mosquitoes and other insects away from you. Protect your partner because it can be sexually transmitted. Let me see, the next one I think, well. So here's the thing, I mean, if you've had symptoms, then you use condoms or not have sex for 6 months after the symptoms begin. This virus can last a long time and can be transmitted. If you never did develop symptoms, but you were in an area where you had been exposed and had one of those, you know, asymptomatic infections, or had been to the area but didn't get Zika, that's 8 weeks after return for travel. So if you're pregnant, don't go to the areas where they have Zika. I have had people had to go there for their work, and you want to make sure that you're protected, and you try not to be pregnant or get pregnant in that area. The CDC has a page where you can look up all the latest Zika information. This is my kind of travel. There aren't too many bugs when you get up there. So the Zika summary, to put it all in one slide here. Transmission, you can get it from a mosquito bite, mother to fetus, sexually transmitted. As far as symptoms, if you do get sick with Zika and get symptoms, it's fever, kind of a sandpapery red rash, red eyes, joint pain, and you feel crummy for about a week or so. The way to protect yourself is to wear long clothes, stay inside in air-conditioned buildings, have netting, and use insect repellent. For travel in general, see your regular physician to make sure that you're ready to travel someplace. If you have coronary artery disease, or if you have medical reasons that could affect your travel, see your regular doctor first. But if you're going to be overseas and have extended travel, think about going to a travel medicine clinic where we see this stuff all the time, and plan plenty of time for immunizations and medications. And always ask a lot of questions. So I have contact information. And watch your step wherever you go. So, you know, kind of what I do in a travel clinic is figure out your itinerary and see where you're going to go and see what kind of immunizations you need. But then people have questions afterwards, so I give you contact information so you can get hold of me afterwards through email. And email works pretty well, you know, almost all over the world. We had a guy who was in Zambia, and he was in a village that was right underneath a cell tower, but he couldn't make a cell call. It didn't work because of the protocols, but he could send me text messages from the middle of nowhere. So text messages, email, people think of things after they're out of the office. It's like, oh, I forgot to ask. So I try to make sure that I get all your questions answered before you go. And then if you did happen to get sick when you get back, then it's something that we can usually take care of. So I'll leave that and see if you'll have different questions and see if there's anything I can help you with.
The connection with Guillain-Barré and Zika, that's a pretty low risk, isn't it?
That is a pretty low risk. Yeah, most of the people who get infected with Zika don't get symptoms at all, so it's a very small percentage of people who do get symptoms, and then it's a much smaller percentage of that who get Guillain-Barré.
I have a friend who had that, so that was not much fun at all.
From Zika or from something else?
Good question. That was quite a few years ago. It was in Argentina, if I remember right, so it's possible.
Yeah, it's possible. The other big association with Guillain-Barré is with Campylobacter, which is a bacterial gastroenteritis that's common all over the world too.
A specific question, we are planning a trip to Mexico, and we have a granddaughter who's 7, whose mother is feeling as though it's not safe to go there, that she has, if I'm saying this right, enough neural stem cells yet to go in her development, that she would be in danger. Care to comment on something like that? Is there a period at which a child is mostly out of danger, or is it better to be overly cautious?
Well, that is a good question. I like that one. In terms of your immune system and development, there's a time where infants, when they're born, if they're breastfeeding, then they have real good protection that the mom gives them. And then there's a period of time about 12 to 18 months where they're starting to make their own antibodies and their immune system is not fully developed. Up to about 2 to 3 years. After they're 3 years old, then you pretty much have a fully functioning immune system. So 7 years old? 7 should have a fully functioning immune system by then. And the risk is about the same as other adults. So they're not really considered immunocompromised at that point. But then again, it's still better safe than sorry.
Yeah.
And depending on where you go in Mexico, I mean, that can be a risk too. Places like the big resorts, like in Playa del Carmen and, those kind of resort areas, they spray the heck out of the mosquitoes. So you're not likely to see things like malaria or Zika or some of these other things like dengue and chikungunya. There's a lot of other things that are out there that we see.
Well, I know that, I know where we go, they do spray. We're aware of that. Is there danger, like just in flying into the airport, being in a cab on the economy? Then does that make you more susceptible? Or the fact that resorts are spraying pretty well knocks it out for a while?
Yeah, it pretty well knocks it out. There's a fair amount of overspray. So they're spraying in the cities, they're spraying in the resorts themselves, and there's a lot of carryover. So your risk is pretty low depending on where you go. I mean, Mexico has been pretty safe so far.
This is Puerto Vallarta we're thinking of, so that's certainly a tourist
risk,
area.
yeah.
Low risk, okay, thank you.
Bigger risk from the traffic and the drug war shootings.
I need to get you closer to the microphone, right?
Just to follow up on the last comment, I will be there as well. And I looked a couple days ago on the number of reported cases in the different states in Mexico. And the question is, like Oaxaca had nearly 500 reported cases, and the state near Puerto Vallarta had 7. The question is, how reliable are those statistics being reported in current day Mexico?
They can't be 100% accurate because they're not testing everybody in the area. They're looking at symptomatic cases.
Yeah.
So there's a pool of people out there that's larger than that haven't had any symptoms. As far as, is Mexico, I think the reporting is pretty good. If you get someplace like Tanzania, then it's kind of sketchy. The Ebola reports that were coming out last year during the outbreak were wildly inaccurate at times, depending on which region you were talking about.
I had two questions. One, is there a vaccine against valley fever that's in Arizona a lot? And also, what is the illness that everybody gets on those big cruise ships?
Oh, in terms of valley fever, there's no vaccine for it. And it's one of those things that, similar to the Zika, where most people are asymptomatic. And most people get exposed to valley fever when they go to Arizona, Southern California, Middle California, and they don't get any symptoms at all. Some people get this mild flu-like illness with a lot of muscle aches and pains. If you do get symptomatic valley fever that doesn't go away, there's really good treatment for it.
What is the illness that everybody gets on the cruise ships?
The diarrheal illness, norovirus.
Yeah. And what about that? Is there a way to avoid that?
They're working on a vaccine for norovirus. Actually, it was one of them was developed here in town. What's now Takeda was Ligocite. So they were doing human testing on the vaccine. So I was hoping it was going to be out by now. There's really not a good way to protect yourself from norovirus. It's highly contagious and it's on fomites, so like silverware and plates and things. So it gets into the food preparation process, but then it spreads through the place settings and person to person very quickly. It's a very small virus and there's no way to protect yourself from that if you're in that situation.
Okay, thank you.
Yeah, you just kind of try to pick your cruise lines by, where these reports are. And there is a way to track the reports of norovirus on cruise ships.
I have just a quick question. I'm going to Mexico. My friend that's been there, she said she puts a little bit of hand sanitizer on her apples and vegetables and, precautions like that to keep from getting sick.
That may help some, yeah. Most of the hand sanitizers are an alcohol product, so that may help cut down some of the bugs that are on the fruits and vegetables.
It sounds really gross to eat hand sanitizer. I don't know.
Iodine tabs work good for that, for making a rinse for vegetables. and fruit.
They do. Mm-hmm. Yeah, and one of the best things that you have to protect you from getting sick is your stomach acid. If you're not taking antacids, if you're not taking PPIs like Prilosec or Nexium, Zantac, Tagamet, if you avoid all those kind of medicines and your stomach acid is there, it takes a much higher dose of these bacteria and viruses to cause illness. If you get rid of your stomach acid, it's like 1,000 times less germs are needed to cause you to get sick. So use your stomach acid. All right, we'll call it a day then.
Thank you.
Thanks.